In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now, we're going to focus on ring-fencing funding for education. It's a no-brainer, really.
Yeah, it's an easy win, this one. What we're asking is for the government to ring fence a certain amount of money to be used for this kind of oral health prevention training programs. Now, this could be, as we spoke before, about brushing programs. It could be about, just having things that the local authorities put together, whether that be, in some cases, it could be giving every child a toothbrush and toothpaste. It could be something like that. But you've got to have somebody on the end of that toothbrush and toothpaste that shows them how to use it. So it might be sessions that certain groups of the community are invited to. It might be displays in community centres or doctors' practices or clinics, or, just so we have somebody that is aware of what they need to do, because often the argument is, well, I didn't really know how to do it, or I didn't know what I was doing, or
100%, 100%.
and
We hear it so much.
yeah, and we need to take that almost excuse away. And it's all right saying, yeah, we're going to give this money, or we'll raise it by doing this, but we need it ring fence. We want to know that this amount is going to be set aside in the budget for better oral health for all. And as we've said before, better oral health equals a saving to not only the NHS, but to patients, to dental practices, because if you have lots of patients who are all dentally fit and have beautiful mouths, you can see other patients, so you can fit more people in. So aiming to get everybody on board with just knowing the basics. We're not asking them to, go out and buy all the latest gadgets. It's brushing your teeth 2 minutes twice a day, last thing at night preferably, using a fluoride toothpaste. It's not rocket science, but we need to be there on the ground with the resources that we need to actually make sure that everybody is included in this. Not just the people who we already know about it. We need to get to the people that perhaps don't go to the dentist very often, that maybe don't know what to clean their teeth with, and how to do it, and how to clean interdentally, etc. And good oral health. So looking at diet and reducing the amount of sugar, understanding about free sugars, understanding about the way that sugar affects our teeth and gums, and just giving people the basics. All we're asking is for some of that money just to be put aside so that we know it's there. And maybe if there's more need in certain areas, I mean, we can look where there's more decay, certainly in children, and maybe they need more help than perhaps somewhere that doesn't. And when we've talked about fluoridation schemes in water, obviously those help. So it may not be those areas that need quite so much help in this kind of education. But
absolutely,
we need to have a look, children, older people on lower incomes, people from certain areas that don't have fluoride in their water are all going to benefit from this. So let's get some formal money.
I mean, there's so many people that we speak to, and especially with the Smile Month just gone, who are going out in the community and they are educating not just the children, but people that have found themselves on hard times, people who are in like ethnic minorities, people who need more support, elderly people on low incomes. And if you've never been shown and never been told, then how on earth would we expect anyone to be able to know
Totally,
it.
totally. Even if somebody wants to just come and ask a question, I mean, no question is a
Yeah,
stupid
absolutely.
question. It's just something you don't know. And, I'm always one for saying if you don't know something, ask somebody. But if the facility isn't there, you're going to want to ask. So that's all we're saying. And like I said, it could be something really simple, just like a display about teeth with, maybe a bit of advice on it and maybe a number to call if you want to speak to somebody, which would be ideal.
Absolutely. This is a no again, and I'm not sure like most of the things on this list, bit of a no-brainer. We know people need more education. That can't happen without the funding. The funding needs to be ring-fenced in order to be there. So
Yeah,
that's what it
yeah,
comes down to at the end
yeah.
of the day. Read the full manifesto on our website and get in touch with your local counsellor to see what they're planning to do to improve the oral health in your area. Next time, we're going to have a look at integrating oral health and general health.